presenting on pneumothorax and atelectasis. So what is a pneumothorax? It is the presence of air or gas in between the lungs and chest wall. This causes a collapse of the lung, and if only part of the lung is collapsed or is affected, it is called an atelectasis, whereas if the whole lung collapses, it's a pneumothorax. So the pressure, normally in people, the pressure in the pleural space is negative during the entire respiratory cycle. Two opposite forces result in negative pressure in the pleural space. The negative pressure will disappear if any communication develops. When a communication develops between intrapulmonary air space and pleural space, airflow into the pleural space until there is no longer a pressure difference or communication is sealed. So there are 4 major types of it, although there are a bunch of other types too. But traumatic pneumothorax is when injury to the chest is caused by a car accident or a gunshot wound. And then tension pneumothorax, this one can be fatal. This occurs when pressure inside the pleural cavity is greater than the outside atmospheric pressure. And it can force the entire lung to collapse and can push the heart toward the lung, putting pressure on both of them. Then there is primary spontaneous pneumothorax, and this happens with a small air bubble on the lung ruptures. This usually happens when you're like scuba diving or mountain climbing. And then the secondary spontaneous pneumothorax is common to those who already have had or have a lung disease. Since the lung is already compressed by the disease, it may diminish capacity, so it can be a very serious complication. So the causes and risk of them, some of the causes is chest injury as like car accident or gunshot wound or stabbing or something, then lung disease, a ruptured air blister, or mechanical ventilation. It is really common with mechanical ventilation to get a collapsed lung, so they have to watch those people very carefully. And then some of the risk is smoking, genetics, lung disease, and if you've had a previous pneumothorax, it is very likely that it will happen again. Some symptoms you may experience are shortness of breath, chest pain, and it may be more severe on one side depending which side collapsed, pressure in the chest that gets worse over time, increased heart rate, rapid breathing, or blue discoloration of your skin or lips. Treatment, it really depends on how severe the pneumothorax is. They try not to do anything if possible and just keep you on observation, but if they can't, they will do a needle aspiration. Chest tube is very common. Usually that is the main source of treatment if they have to do a treatment. And another one is surgical or non-surgical repair.